Good evening, everyone, and thank you for logging in for this very interesting session today. I feel transplants in thalassemia is a very important and very complex subject. I also personally feel that it's one of the most difficult transplants to do because the outcomes of the transplant are not only dependent on the donor types, but also to a great extent to the host, and that is the type of thalassemic patient you're dealing with. And of course, there is lots to discuss on the conditioning and other things. We are the thalassemia capital of the world. In the pediatric transplant practice, almost 30% of the transplants which happen in India in the allogenic field happen for thalassemia major. So hence, it becomes a very important subject, and I should thank CELON to bring us all together on this platform to discuss this very important aspect of our practice. I'm also fortunate to have a battery of experts in the field who have a tremendous experience of decades in working in the field of transplant and especially with thalassemia major patients. It's a pleasure to be kind of sharing this platform with my teacher, Dr. Sajid Prakash Yadav, and also my colleagues and friends from different part of the country and from very good institutes with tremendous experience in this field. So without more ado, I will try, I'll kind of start the proceedings for today. We have three components of today's session webinar. First, we'll be discussing risk stratification, which is extremely important in thalassemia. As I said, it's a very heterogeneous population, and every patient kind of should be dealt in a different way. And with a focus on reduced intensity conditioning and its role in thalassemia transplants. So Dr. Satyendra Kateva, who is my friend, Senior Consultant Head of Pediatric Hematology Oncology at Manipal Hospital, Jaipur, is going to be discussing the first topic. And then we will be discussing another, I would not say controversial, but very frequently discussed topic about haploid transplant in thalassemia. And then we have the panel discussion, which is very important. And that idea during that panel discussion would be to highlight some of the unique complications, some of the unique aspects of thalassemia transplant, which will be monitored by Dr. Gaurav Kharia, and there will be panel experts discussing the various aspects. So I'll hand over to Dr. Satyendra Kateva to start the proceedings with the risk stratification and the reduced intensity conditioning. So for all the audience, who just post your question in the Q&A session, I will try to collate them and ask them to the faculty once the session is over. Over to Dr. Kateva. Thank you very much.